Hello, dear aquarist. Welcome again to my next video on fish disease case number 195 about the Synodontis catfish. Originally a Tanganyika catfish, petricola, which this one is a tank-raised one, and watch the video. I show you how the fish look like, not so good looking, and I show you my findings, which I show you with the help of my microscope, so you can understand what a disease can be and what you can do as a treatment. So watch my PowerPoint, which I will share with you and explain you, well, what we do with diseased fish. Here the petricola did become skinny due to parasites internally, Spironucleus. Yes, a parasite which is common in discus fish and cichlage and angelfish, etc. Also some other fish like clown loach or neon tetrads, like here. Also in the Synodontis, you can find these parasites. And at the same time, we found a bacterial infection. Learn my diseases or learn your solutions to fight the fish diseases of your beautiful fish by learning to study in books. And I made these books for you available so you can be more professional and more aware what you can do about treating fish. Here we see some of those Synodontis that become very skinny. You can see they're swimming. Here we can see one, a skinny one, which is not actively swimming. I'll show you again the video. Some are separating here and not so actively. This one also here. Other ones look fine and healthy and not showing any particular problems. And those are weaker ones become darker in color, and some did die. So that's why this case was brought up to me. And the first thing I found were that the gills of that fish were stressed. Stressed gills. Look at the hyperplasia, the blowing up lamellae. And that can caused by different things. Could be an internal problem, could be a water quality problem. Here the water quality was okay, so we were thinking, well, the fish suffered from something internally. And then, well, we saw the parasites moving into the water. Let's see, put the video on for you. You can see here the tiny parasites. Hard to see, you have to learn to see here. Next to the excrements which are here, you see the tiny parasites at a 200 magnification. And that's how you learn to recognize that these are things which is troubling the fish. Here we see it again. You see the tiny parasites? Learn to detect that in the microscope. They are 50 to 100 times bigger than a bacteria. And they're moving around. Here we see that at 400 magnification. You see the tiny parasites moving around. Many of them are here. And particularly you found them in the excrements, in the intestine, where they cause damage to the intestine and cause bad problems in, how can I say, absorption of the essential feed nutrients. We also examined the kidney. You can see here the black spots in the kidney. It's the calcification or obstruction of the tubuli, which is causing a problem of the health of the fish. So treatment, in general, most of the fish look good for now, but they must be treated before more fish getting sick, because it can advance. I would recommend Metronidazole or a similar product from the pet shop and combine this with an antibacterial medication. I give some suggestions in my book, or you can ask your pet shop or your fish doctor. We recommend for this kind of problem Dr. BASSLEER BIOFISH FOOD LAPACHO that helps in the control of the parasites and a faster repair for the fish. Avoid feeding live or frozen food for at least 4 weeks, and in future, limit the percentage of frozen live food to a maximum of 10 to 20%, and try to stay with safe granulated food like the Lapacho or the regular, what we recommend to use. Learn this from my books on fish diseases, so you become more experienced. Or get a special training at my fish doctoring at my Patreon channel. So I hope this helped you to understand Synodontis, wasting away, dying, particular things we could see with our eyes. So we use a microscope and detected the problems. I hope this helped you to understand fish diseases. And like this video and stay tuned to watch more videos coming. Interesting for you. Thank you.